You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Thank you for listening to Bark and Wag 15-Minute Vet Talk. Bark and Wag is dedicated to protecting our dogs through advocacy, education, and supporting like-minded dog lovers by selling custom pet products. Bark and Wag is excited to announce our new partnership with a Colorado hemp farm to produce a line of CBD products for your pets. Bark and Wag has CBD pet tincture available in 300, 750, 1200, and 2400 milligrams. Bark and Wag CBD is pet safe, no THC, it's made in the USA, and is CO2 extracted. Please check out Bark and Wag's website, barkandwag.com. That is BARK, to see our line of CBD and awesome merchandise. We love pooch ideas for podcasts and merchandise, so anytime send an email to Polly at barkandwag.com with your suggestions.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Lori Cesario, owner of Canine Cancer Academy. Today we're going to talk about how important cancer detection is for your pet. Thank you for coming back on the podcast.
Thank you for having me.
Yes. I wanted to have you back to discuss which breeds are predisposed to cancer, different cancers, and really kind of how an owner can be proactive. So just to give a background, which Chuck the Pug, we have Chuck the Pug Jr. now, but Chuck the Pug Sr. is one of our Bark and Wag models. And he developed a lot of breathing problems and eventually it was cancer. But I was pretty on it. And so if my vet who I loved and really kept him alive 2 years after he was diagnosed. If she wasn't able to help, I went to a doctor in Denver who could, better equipment to see what was going on inside Chuck's body. And I felt that I felt that it was my responsibility to make sure that he got the best care. And I also knew, especially having pets, that at one point you have to let them go when it's time. But I just wanted to have you back to discuss, what an owner should look for and what breeds, I know Goldens get certain type of cancers and labs. And so I just wanted to have you back to discuss that so owners can be aware.
Mm-hmm. Perfect. And yeah, exactly like you said, and exactly what you did with Chuck is what I typically recommend. So, there are some veterinarians that have access to different diagnostic tools than others. And, there are some times where we need an advanced type of test to be able to make a diagnosis. So I would say that if one person isn't able to make a diagnosis, but your dog is still showing the sign, then it just always helps to get a second opinion, just like in human medicine. So basically what we can do is just run through a few different types of tumors, and I can talk about what this tumor might look like, and then also what breeds are typically predisposed.
Okay.
A really common skin tumor that dogs get is called a mast cell tumor. And the interesting thing about mast cell tumors is that they can sort of look like anything. So they can look like a little, not to scare people, of course, but they can look like a little hairless pink bump on the skin. They can look like a fatty tumor. They can look like a little wart. The interesting thing about mast cell tumors, though, is that if anybody tells me that they have a tumor and then it went away or shrunk significantly, and then it came back, and then it went away and came back, the first thing I think of is a mast cell tumor. That's very common. They also will sometimes feel itchy. So if your dog is licking at it or scratching it, it might feel itchy and it might be a mast cell tumor. And those are most common with dogs of kind of bulldog descent, like your Boxer, your Boston, your Pug, Frenchie. But Labs and Goldens, Cockers, Staffordshire Terriers, they also get them. It's the most common skin tumor in dogs, so we see it all the time, but that's definitely one to look out for. Another common thing that we see is dogs that have tumors that arise from the nail bed or the toe. Usually we're not thinking that a tumor would occur in this place, so it's very common for it to look like an infection of the toenail or the nail bed. People think that maybe they went for a hike and got something stuck in there, and so it's treated as an infection for weeks or maybe even months. So I would say that if your dog has a swollen digit or what looks like an infection or a painful nail bed and a round of antibiotics isn't fixing the problem, then it's probably time to take a sample. And
is that like a melanoma?
It could be a melanoma. We see melanoma is the second most common type. We see those more commonly in like a Scottish Terrier. Squamous cell carcinoma is the most common type. And we'll see those with standard poodles, black labs, giant schnauzers, Rottweilers, Gordon setters, often like black coated breeds, things like that.
I was just thinking when you were talking, so really Chuck's cancer was in his mouth. It was melanoma.
Yes.
Yep. And it just sat there.
Yeah.
And then all of a sudden he's got all these spots on his lung. So it spread to the lung. Yeah. So
melanoma is definitely the number one type of cancer, number 1, 2, and 3 type of cancer that we see in the mouth of dogs. And usually just from the melanin pigment, it will look black or dark in color, although there is a non-pigmented version. So just kind of getting used to looking in your dog's mouth is reasonable. And just like you mentioned, it does like to spread to the lungs. And most dogs won't have any signs when cancer spreads to the lungs. So it's just nice to kind of be on the lookout for things. But we definitely see melanoma in chows and Shar-Peis, but because it is the most common tumor of the mouth, we do see that in any breed. Okay. And then, of course, like you mentioned, golden retrievers, many of those dogs will get over 50% will get cancer, and that can be sort of anything, lymphoma, mast cell tumor, osteosarcoma, all different types of cancers. Right. Osteosarcoma is the number one type of cancer in dogs. So I think the surprising thing for most people is that they might just have a little limp. So, of course, if a dog is limping, it could just mean that they overdid it playing or outside, or it could be a soft tissue injury. But if it's something that isn't responding to rest or medications, that's where it's probably time to take an X-ray and just make sure that the bone and the joint looks appropriate. And typically we see osteosarcoma more in the long bones, like of the legs, and mostly large breed dogs. So those are going to be things like Great Danes and Golden Retrievers, St. Bernards, Irish Setter, Dobermans, German Shepherds, those sorts of dogs.
And when a vet takes a X-ray, can they see cancer, or is it just to see that there's like a spot?
Like when you're talking about a chest X-ray to look at the lungs?
Yeah, or even like if you take a leg or,
So, yeah, that's a good question. So if a dog is limping and we take an X-ray of the leg, we're looking to see, like for osteosarcoma, for example, that's the most common bone tumor. We're looking to see if there is destruction of the bone. Like if it looks like there's tumor destroying the bone and making new bone, there's kind of a classic location where this bone tumor occurs and a classic appearance. Still, many times we like to sample the bone so we're 100% certain. If we're taking an X-ray to look at the lungs to find out if there's cancer there, like before surgery, or if a dog is just not feeling well, if cancer has spread from somewhere else to the lungs, then typically that pattern is going to look different from if cancer started in the lungs. So if cancer spreads to the lungs, we'll typically see these small little white circles, one or more than one.
Mhm.
And that usually tells us cancer spread to the lungs. But if cancer started in the lungs, like a dog that has a lung tumor, normally that's going to be one large mass just in one part of the lung.
Okay.
Yeah.
Okay. All right. Any other tips for our listeners?
I would say, another thing that maybe is diagnosed more slowly is everybody knows what a urinary tract infection looks like, I think. Maybe a dog is having some difficulty urinating or has to urinate pretty frequently.
Mm-hmm.
If that doesn't respond to antibiotics, then it's a good idea just to get an ultrasound of the bladder just to make sure there's not a bladder mass, because sometimes cancer can have the same exact signs as a urinary tract infection. So we don't want to scare people, and we don't want people to be paranoid that their dogs are developing cancer all the time. Of course, it's just something to keep in the back of your mind and something just to be thinking about. Anytime you can make an earlier diagnosis, we usually have a better outcome. So if something's off, you just want to try and figure out what's going on, and your vet can start the process.
Well, and it's, they're so small, so it just tends to spread so much faster in a dog than you see in humans, or it's sad because it's your little baby.
I know. And yeah, I think the other thing is just to kind of like really pay attention to maybe when you found the mass, because, we get busy with other things, and then all of a sudden it's been there for 4 months and 6 months, and 6 months is a long time not to do something about a mass. So
Sure.
if you notice something, you really want to kind of get on it and get a diagnosis and figure out what the best path is forward.
Well, these are great tips, and I certainly appreciate you being on the podcast, and I hope you come back.
Thank you for having me.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.